That one's more challenging, right? Yeah,
Well,
so
this
I,
morning, Andrew Cuomo talked about, I mean, I'm sure people all over the country listen to him. But this morning he talked about how in New York City, where I live, they have been able to track the zip codes from which the highest portion of coronaviruses patients or people who've died live, and it's twice as high as other neighborhoods. Um, where I live, I haven't heard about too many cases in my neighborhood. I've heard about cases in my workplace. I'm a lawyer, so there's lawyers and support staff in my office who've gotten sick. One person I know of died. But, you know, we're basically a highly educated group of people. We live in good neighborhoods. We have excellent health care. We're all able to work from home. And so even despite that, people are getting sick.
yeah.
And some comments in the chat are population dense areas in city living, there is usually lack of access to fresh food, socioeconomic levels in those neighborhoods, and access to resources and medical facilities.
Yes, exactly. All of that. And it's a whole nother presentation, the amazing work that's being done. And if you have time, you can sort of trace down some of the resources we have at the end, but the area codes seem to be having a direct linked correlation to, again, a variety of outcomes. And there's a lot of research being done to try to understand what that is all about. But I think everything that you all have mentioned is accurate in terms of finding correlations in the research. So Michelle, can you show us the next slide? The next slide that we're seeing here is an example of how we might think about health outcomes, again, thinking about social determinants. So all of you are clearly social scientists in your way of your thinking because, as we mentioned, sort of educational attainment could be directly related to health knowledge. So we heard that through some folks' examples. But also this educational attainment, as many of you mentioned, then affects work, and then work affects working conditions, your resources, healthcare, etc., income, your ability to balance work, family, stressors, etc. That's all health. And then, of course, educational attainment is linked up just to your total sense of you know, how much do you control your own destiny? And that seems to be highly correlated with stress levels or not. To what extent do you have choice and can social standing, et cetera. So you can imagine all of that then, again, thinking about educational attainment in the middle, going to work, going to income, then affecting your housing and neighborhood environment, right? So, and then finally we talk about health. So this is that social determinants model, right? It's much more complex, and so we have to think kind of carefully about that. So maybe then it's not surprising, as we'll see, if we already have inequities in the United States based on some of these outcomes, then to see a pandemic come through, you see maybe an exacerbation of that. So Michelle, next slide.
Yep, and before I do that, just want to let you know there was a comment in the chat that says, I live in a rural neighborhood where people tend to be conservative politically. My neighbors don't believe the virus is a big deal because it hasn't hit hard here yet.
Yeah, so again, that abilities, certainly maybe depending on educational attainment, but if you're able to kind of discern what might be my cognitive biases, the things that I might willingly or not willingly accept as knowledge, certainly we hope that people at least graduate from college having a little bit more of a critical framework to think about, you know, I know what I want to believe, but what does the evidence tell me as well? So it's definitely, we're seeing clear indicators of people exposed to different sources of information having different ideas about what they believe, and then those beliefs translating into behavior. So it's very important, again, to go back to that social determinants. What are the resources fueling people's ideas and behaviors? So it's a very social science arena. So I just wanted to give you some examples of what we know about social inequities, you know, pre-COVID. These are data from the U.S. Bureau of Labor Statistics, really from 2014 to 16, but we consider them rather current. And Michelle, if you could maybe go on the sort of slide 3, which shows us educational attainment differences. If we look at this together, the purple and the pink to the far right of these bars by race ethnicity. So this is sort of intersecting race ethnicity with class, right? Socioeconomic index. And so education is a key contributor to social inequalities, or helping to dissolve social inequalities. But we can see that African American populations, Hispanic populations, people that we consider people of color in the United States, have lower on average educational attainment, especially looking at bachelor's degree or higher, because that particular indicator seems to be pretty important for predicting a lot of social outcomes, including health. So African Americans are less than 30%, Hispanics are around 20-something percent. And if we keep going down, we'll see that compared to whites, which are usually our comparison group when we talk about race ethnicity, but they are closer to, I think, 40% have a bachelor's degree or higher, right? So somewhere 30 to 40. And note our Asian American population has over 60% with a bachelor's degree or higher. So we have that existing inequity, and we just saw education is so crucial to a variety of other outcomes. We could also then look at number 2, which is actually the income differences that we see. Again, these are 2014 to 16 statistics, and I'm going to focus on, Michelle, can you put on the African American, and then I'm going to focus on just median. It's a better measure for us for income compared to averages, which can get a little skewed with high values. But the median income, and this is for U.S. households. So for U.S. households, so all earners contributing to that household, it is $34,500 for African American households in the United States. And then if we go down, Hispanic Latino is coming in as a median of 42. American Indian are coming in at a median of 37, right? So we can kind of see this pattern of the median. Multi-race are going to come in a little bit closer at 44, right? Hawaiian is 56, and then white we have here at 54,000, right? And then the Asian population, again, they have higher education levels, so their median is higher at 66. So you can see this correlation between education and income being reflected. And again, as we saw, income then has consequences for other outcomes. We can look at number 6, maybe, Michelle, I think that's our housing one. Yeah, so one of the biggest divides that we've seen in the United States historically has been housing segregation and ownership. So we have high levels of segregation by race, ethnicity, and class in the United States. And we also see this kind of wealth gap, that a large percentage of this is due to the gap in home ownership. So African American population in the United States have about 40% of their population that have own a home with or without mortgage. And again, if you just follow this sort of green and black symbols here, you can see that definitely compared to all other groups, white populations, people who identify as white households, have a larger home ownership percentage. So over 60% of the white population own homes. And again, this goes back to owning homes, and often in areas that are resource rich, right? So they have a lot of resources in those neighborhoods. And if we think about structural inequality, one of the ways that we have to think about this is that these patterns are not just based on because some people wanted to own a home and some didn't. We argue it's not just choice, but it's also constraint, and it's constraints that have a historical legacy. So if we just go back to New Deal policies and legislations that said, hey, America, we want you to go out and own homes, right? It's this kind of framework that everybody should try to own a home and have this most basic human need met. But 98% of those loans that came out from a federal level to encourage Americans to buy homes went to white people. So 98%. So that was considered one of the biggest policy moves we had in the United States to encourage home ownership. And we've continued to see in the 20th century and into the 21st century examples of policies that try to get rid of the discrimination that may be happening, but are not always successful in doing that by race, ethnicity. So trying to address this is pretty important. Yeah, and maybe just number 7, Michelle, I think that one is about our sort of health monies that we put out. So if we have different incomes and different resources, then again, oh, no, I'm sorry, try number 4. So here's household spending. And if you look at that light blue little column for each one, this is showing expenditures for each population that again are closer to 2,500 for African American and Hispanic, and then go up for different populations. Multiracial whites spend about 5,000, so about double. And if we were to look at this as percentages, African American, Hispanic, and I think the Asian population, they spend about 6% of their income on healthcare, and whites spend about 9 or 10%. I don't know if it's wise spending or not, but they're spending more. So these are all examples, you know, that we have of existing social inequities, and they're deeply embedded and they've been happening across time. So we're getting a little bit better in reducing some of these, but some are quite stubborn, especially the home ownership and the neighborhood segregation. So with that, I think I'm going to turn it over to Dr. Gricus, and
All
let
right.
her interact with y'all a little bit.
So since you've taken a look now at some statistics, let's turn it back to you. So what are some of the populations then that you would expect to experience greater social vulnerability relative to the pandemic at this time? So feel free to speak up if you'd like, or jot something down in the chat and I can read that aloud. So what would you anticipate? Would you anticipate similar, different kind of results in terms of who is more vulnerable to being diagnosed or being able to recover?
Somebody can guess a wrong answer.
All right, so we have a comment that says minority groups.
Yes.
Native American populations seem to be hard hit. The question is maybe, is it related to access to healthcare? Anticipate a similar pattern. African American and Hispanic populations are more vulnerable because they rent at higher rates or more densely populated areas. I mean, I think, Dr. Moore, we can just shut this down now because everybody knows all the things that we know. So that's good.
I'm so thrilled to hear this level of discussion, though. So as a sociologist, it makes my heart go pitter patter. So it's exciting to me.
And then another comment, and feel free to keep them coming. We can certainly multitask. Last comment here is pre-existing health conditions in African Americans. So fantastic.
Yep. And again, I'll just note pre-existing health conditions, though, in a social determinants model would say, where do those come from? So we never stop in a social determinants model from saying, well, that group is just like that, right? We say, why? Why are there differences in any of this? And we go back to this model and try to tease it out. So, yeah. Density.
All right.
Yeah, so great examples.
And so exactly your thoughts are what the kind of headlines are telling us. And we know just from watching the news or listening to the news that there's a lot out there about this that says that Black Americans and Latinos are 3 times as likely to know somebody who died of COVID, for example. In Washington, D.C., African Americans make up 46% of the population, but 80% of the deaths related to COVID. Residents of majority Black counties have 3 times the rate of infection and almost 6 times the rate of deaths as those who are in majority white counties. Half of lower income Americans report household job loss, and U.S. Latinos are among the hardest hit by pay cuts and job losses. So again, perhaps not surprisingly, as all of you are pretty adept in kind of understanding that this is what we're seeing, right? That it's become very apparent that if something existed before in terms of an inequity, it's exacerbated by what's going on now. And so here are some kind of other ways to think about that. When we look at kind of, are people able to sustain their current way of living if they do lose a job? Maybe do they have rainy day funds? Those are often called. And in this case, we can see that in the last couple of months from March to April, that every population has been affected, certainly by people who have needed to take a pay cut or who have lost a job. But we see that those rates are disproportionate again. So seeing in the Hispanic population, 49 to 61%, have either lost a job or taken a pay cut, 36 to 44% of Black households, and 29 to 38% over the last couple of months. And then just in terms of the rainy day funds, we see and kind of that bottom part here, that Black communities only, or 73% of that population say that they do not have enough funds to get through 3 months. Hispanic populations are nearby with 70%, but only, and that's still a significant number, 47% of white populations. And then kind of similarly, if we pull that out a little bit more, and a comment was made earlier in the chat about age and what are the ways in which kind of age can impact kind of homeownership and those kinds of things. But we can see here specifically for this rainy day component that age is a factor. People, older the person is, the more likely they are to have rainy day expenses. But we also see, looking at this educational attainment, as Dr. Moore was saying earlier, that if a person has a bachelor's degree, 66% of them have enough money to cover expenses, whereas somebody who has a high school diploma or less, only 33% of that population. And so we see, again, kind of from the educational attainment to race, and in this case, age as well, that and income are definitely factors in what allows somebody to save and really get through something as tragic as a job loss. And that kind of ties back then into what we were talking about earlier with regard to these conditions, right? So if a person is losing a job, what are the impacts that has on everything else in their life? What are some of the ways in which that social vulnerability kind of continues to multiply over the course of someone's life as in this case, a pandemic kind of comes through their neighborhood, comes through their home and their communities. And a lot of you mentioned these things, so I won't get into this in a ton of detail here, but just that those factors that can influence the prevalence and recovery rates of COVID are, as many things that you mentioned, those pre-existing health conditions, having population-dense areas, and having a lack of health insurance or not being able to have flexibility in working from home, certainly. And we see that these kind of differences show up in a lot of different places, not only just in communities where people choose to live, but also those places like jails and prisons where people are, densely packed as well. And then also we see racial and ethnic minorities overrepresented in those spaces. All right, so you've given a lot of thought to this, and again, you probably could have given this instruction because you've all done such a fantastic job, but what are your thoughts and feelings upon hearing this information? And if you'd like something else a little bit kind of more dense to kind of think about, what do you think about the statement that coronavirus does not discriminate? In what ways is that true, and in what ways is it maybe misleading? So if you'd like to throw your thoughts out in the chat, you're welcome to do that, and I'll read them out loud. Otherwise, you are certainly welcome to raise your hand or to just speak by unmuting yourself.
May I ask a question?
You may.
Of everyone. I know as a sociologist, I'm very attentive to, when these topics come up through news focusing on inequalities. Are all of you seeing that like I'm seeing it? I feel like it's gotten increased attention, which makes me happy to see us focus on that as a nation. But are others seeing it or not seeing it in the news in terms of something that would draw our attention to underlying issues?
I don't think it is being addressed appropriately because the focus is really on the overall number of positive test cases and unfortunately the deaths. But unless you do a deeper dive like you all are doing to find out where these concentrated areas are, it's not a headline, in other words, to the general public. But mostly I just feel like I want to strangle a person who lives in DC who is just not really taking control of this appropriately. Just leave it at that, Laura.
Thank you, Kelly.
Welcome.
Thank you, Kelly. So some additional comments here in the chat is that African American and Hispanic populations are more vulnerable because they rent at higher rates in more densely populated areas. Pre-existing conditions, density of people within housing affects the spread. Coronavirus does not discriminate, it just highlights pre-existing inequalities. Virus itself does not discriminate, but the socially racist policies of the past have led to harming minority groups in greater numbers. Virus does not discriminate, all else being equal, but all else is not equal. The virus does not discriminate, our society and people do. So fantastic. So we've got some excellent comments from everybody in the chat. Feel free to keep those coming as you'd like. And hopefully I didn't miss anybody. They go kind of quickly. So any other thoughts, or Dr. Moore?
I just want to say one of the things that I think is very important is that we will have time out. We're in the middle of this, so it's hard to discern what to do. And I liked it earlier, Dr. Boyd's previous presentation. She said something that probably is hard for us to think about, but in 5 years, in 5 years, when we get some perspective, the data that we're getting will really be helpful, hopefully, in helping us change policies and patterns. And so that's kind of the goal of understanding the systems that we're in systematically, so we can systematically address them. And there are some policies happening across the United States. One of them has happened in Montgomery County. And if you do get a chance, again, there's some resources that we'll post at the end of this presentation. But some of the policies designed to make us have more mixed income housing, see, we're getting data in that shows it matters. So there are actually policy fixes that we could do in some cases to really affect, you know, this key social determinants of health, like where do you live? Where did you grow up? What were the resources around you? So we have the capability, we have to kind of get the political will to do it, but we're seeing some good things come out of some of the policies in practice. So leaving it on a good note, and then maybe that would again decrease sort of these inequities of social vulnerability that we see in the future. So there's some models.
And Irene has raised her hand. Irene, go ahead.
Hi, can you hear me?
Yes.
Oh, I'm American, but I've been watching this unfold from Germany. And my question is, why is New York hit so badly? We have American cities with many of the same characteristics, but why is New York especially hard hit? Do you know the reason for that?
Well, I mean, it's
I can give you some answers for that.
Ellen's going to speak to it.
Please.
I live in New York. One of the reasons is we rely tremendously on public transportation. We have, you know, population densities here. Things were not taken as seriously as they should have been at the beginning. We have excellent health care, and Andrew Cuomo was terrific, in my opinion. But you know, he's now acknowledged that if he had shut down the city 1 week earlier, and there would have been 50 to 80% fewer deaths in New York than there were. So, you know, there's lots of reasons why it's gotten so hard. And as he says every day in his press conference, we didn't expect the virus to come from Europe. We expected the virus to come from Asia. All these flights came into LaGuardia and Newark, and people from Europe already had the virus. They came in and they got off the plane. They either stayed here, they got on another plane, and the virus traveled around the country. So we're a major vector. We're a transportation hub. We're more densely populated than any other city in the United States. There's lots of reasons, and you know, Cuomo was extremely aggressive about closing things down. You know, as he said, flattening the curve. This morning when he was on TV, he said there were only 76 deaths in New York yesterday, which is still a lot of people. But 6 weeks ago, there were 800 deaths typically every day. So we're working really hard here. I'm fortunate that I live in a house, and it's a big house. There's lots of room. My son went to Hood. I'm in his room now because he left the house many years ago. I've set my office up in here. I'm able to work at home. I go out once or twice a week, always with a mask on, and I see people in my neighborhood complying. Andrew Cuomo has been very aggressive about having people wear masks, and for the most part, from what I see in my Brooklyn neighborhood, people are wearing masks. But it's been a long haul, and it's been very difficult for us. You know, one thing that's interesting is I have some girlfriends from Hood who live in Frederick, and I've said what a pain it is to go to buy groceries. I have a health food store on my corner that we frequent, but there's always a line. We have Costco in Brooklyn, we have a Whole Foods, we have Trader Joe's, we have Wegmans. There's always a line. And my Frederick girlfriend says, oh, I just walk right into the store. So everything you do here is really fraught, and it's just that much more difficult. And people get frustrated, and we're working hard here. We're working really hard here to try to get beyond it.
Thank you so much for your comments, Ellen. We just want to update folks on some things from the chat, and then we're going to go ahead and wrap up for today. So Mary says that she's worried that segments of our government can hide behind the fact that this is a disease that doesn't discriminate, that the political system will turn a blind eye to the pre-existing inequities and how they impact groups differently by merely turning to the biology. And then another comment here, other than being briefly discussed in the news, have there been any other responses, such as through policy or nonprofits, to this research about how different populations have been adversely affected? So I'll just kind of pause there. Dr. Moore, did you have a response to that question?
I haven't heard of specific policies, again, because we're in a pandemic, but definitely at the government level, you know, the CDC and other government organizations have on their websites, they understand that we have inequities. So it's not, the government's not hiding it necessarily. Again, it's one thing to know things, it's another to try to design policy to address it. And I think, as many people have noted, some of our animosities we're experiencing as a nation politically are probably, you know, slowing down our progress. We're not necessarily using total reasoning based on the data to make changes, because anytime we distribute what we consider to be resources, and for some reason in America everybody feels like resources are scarce, even though we're in a resource-rich nation, it becomes political. It just does. And of course we have long histories of race, ethnicity, biases and prejudices that are historical and are continuing. So in that context, you know, what we know and what we want to do can be very different than what we get to get through Congress. So it becomes a political will, and again, that becomes that people have to get activated to write and tell people we want to see change based on policy. So we're trying for evidence-based. But no, I haven't seen specific policies through the research even for this presentation about how to address it, but you can see different governors talking about, we're going to give more resources, for example, to public housing areas in New York, right? We'll get more resources. So there is an understanding that resources need to be distributed where there's higher risk and higher vulnerability. So there's some of that happening state by state.
And it sounds like some folks who are on the training with us would agree. Mary Jean is saying that this disease has been politicized to an extent that astonishes her. Not wearing a mask and not social distancing has become a point of pride for many in her and for her many of her neighbors. And some folks agree with that. So we really appreciate everybody's input today. This has been way better than I thought it was going to be in terms of your participation. So awesome. Doreen says what bothers her is that she has neighbors who are not taking this seriously. They don't social distance. They don't wear masks. They're entertaining at least 15 people. And then a comment of those vulnerabilities affect us all in the long run. That's exactly right, Akas. So we have some resources here if you are interested in looking up some things, but certainly you can really just at this point just kind of Google you know, racial inequities and COVID, and you'll learn all sorts of things. Should you want to get in touch with us to share more of your knowledge and wisdom, you are more than welcome to contact us here, more at hood.edu or Gricus at hood.edu. We really appreciate your participation today and taking time out of your time on this beautiful day, at least here in Maryland, to hang out with us and learn a little bit more. So thanks again so much.
It's good to see everybody. It's good to see some of our previous students especially. So stay safe and stay well, everyone.
Thank you.
And I just want to thank Dr. Moore and Dr. Gricus for doing this presentation today. We will have more faculty at home sessions this Thursday, starting at 1:15 with Dr. Liz Atwood. And then there will be another session at 1:45 with Dr. Stewart. So you can hear about COVID-19 from a communications and mathematical standpoint.
Interesting.
Have a great day, everyone.
Thank you.
Bye. Thank you.